we're going to do is we're going to do a small liposuction procedure to remove the fat, and then we're going to do a procedure called Renuvion, which is for skin tightening. Basically, we're using plasma to heat up the tissue under the skin, and we are able to contract the skin up to 60% skin contraction within 6 months. And what that's going to do is it's going to help kind of lift some of the excess skin here. So she's probably going to see that her belly button, instead of being a line, a little sad face, will hopefully be just a nice little circle belly button like it was before. So that's what we're expecting to do. Are you comfortable? It's a tiny little pinch, okay? Small pinch, 1, 2, 3. Is just a little bit of pinching and maybe a little bit of a burning sensation. Little pinch here. With Renuvion, it is still heating up the tissue, but because we're using plasma, the tissue heats up very quickly and it cools down very rapidly. So you really have to stay in one place for a very long period of time to create a skin burn. All right, so what I'm gonna do is I'm just gonna kind of move around here and see if you're comfortable. Good. So our patient seems to be pretty comfortable, pretty numb, so now we can start with the suction process, okay? And so this cannula is connected to some tubing, connected to a suction container, and that's where the fat's gonna get collected. Okay, go ahead and turn the suction on for me. It's a little noisy. Perfect. You can start seeing little kind of pieces of fat going in here. If you get too close to the skin, you can risk some injury to the blood vessel that supply the actual skin, and that's when you run into problems like skin necrosis and scarring. But if you leave a nice healthy layer, then you're safe. So, you know, even with lipo, we are leaving a very thin layer of fat, and also when you get too close to the skin, you also have more chances of like very uneven contour. Sometimes you see kind of little deep divots in the skin. That can happen if there's a little bit more superficial treatment of the skin. And basically what we do is we just decide which opening we're using. We're going to do multiple strokes in the skin, just under the skin, a few strokes kind of in and out, and we're going to do that 6 times. I'm going to do a little stitch in the belly button just because that spot doesn't really matter too much for drainage, and that way it'll heal nice and pretty. Just going to clean all this betadine off of you. Can you give me a little bowl of water there, Nicole?